Okay, hello. So here is the latest edition of our Neonates in a Nutshell, which we're going to go through today. This is me, Amy, and Gemma is here as well.
Hi.
So what we've decided to pick on to talk about today is just a few of the things that have come up about infection control on the unit. We did a survey this year between January and March, which Gemma, you were involved in, weren't you?
Yeah. So we've been looking at infection rates on NICU and positive cultures. So for January, February and March, we had a total of 106 blood cultures taken and sent, of which 14 came back as positive. So we wanted to look at that as a breakdown. So why were they positive? And what were they positive with? And what we found is that 4 were what we call CLABSI, so central line associated bloodstream infections, 3 of which were related to umbilical lines, and 1 was associated with a long line. 2 of the 14 positive cultures were contaminants, which actually, if you think about the fact that we only had 14 cultures and 2 of them were contaminants, that's about 28%. So there's definitely some work that we can do around that. And all of the rest of the 14 were associated with our peripheral venous cannulas.
Okay, so then we thought, well, with this information, what we could do is if we just try and raise a bit of awareness on the unit about, number one, how can we reduce the number of positive cultures or the positive infections that the babies are getting, but also how can we stop these false positives so that babies are on treatment unnecessarily. So what we were hoping to do today was go through about the Scrub the Hub, which some of you will already be well aware of, but we're just going to go through that again. And then the second bit talking about how to take a blood culture, like the best way of doing it. Obviously not everybody's involved in taking blood cultures, but hopefully if everyone's aware of like how it should all be done and things, and then we can challenge poor practice when we see it. Okay. So let's start with Scrub the Hub. Thank you. So the reason that we've started off with Scrub the Hub on the unit this year was because, as you know, we've all been using Curos bungs, but some of the evidence that's come out recently suggests that there's no difference in infection rates. So obviously that can be seen as a waste of money, but also more importantly is that what we don't want is that people are sort of feeling falsely reassured that a line is clean when possibly it isn't. So the idea is that at some point we may well be getting rid of Curos bungs, so we want to improve our practice. So we're doing Scrub the Hub because that has been proven to reduce hospital acquired infections, which is obviously very important on our unit.
Yeah, and I guess just to add to that, we're going to obviously audit that practice because we want to make sure everybody's happy and knows what they're doing without the Curos bungs before they go away completely, because what we don't want to see is an increase in our infection rates.
Okay, so how do we do it? So it's very important that we use our 70% alcohol swabs, which we've got the blue and the green ones on the unit, and it's the green ones that we need to use because those are the ones that are licensed to use on equipment. And essentially it's just, well, it says here about sort of juicing an orange. So what we're doing is it's got to be for like at least 10 scrubs, but we're saying it's sort of 15 seconds. You start in the middle of the hub itself and just do a really thorough clean, and then just a nice circular motion moving out and then down the whole port to the point, so it's the bit that's going to be in contact with the syringe or the infusion line. Okay. So a lot of information on this slide, but essentially, yes, so what it's saying, why is it 15 seconds? So the test has shown that if you just do the 5 seconds, it's not enough, and there can be up to 67% of bugs are still going to be there. So 15 seconds just makes sure that we've got 100% got rid of any pathogens, and it's just important that if we don't do that bit, then the pathogens can still be present. So at the point when we're then doing sort of infusions, or if we're giving boluses, then you can transfer those organisms into the patient and make them really sick. Okay. And this just further reinforces it, so it's just showing that this is like sort of after the 15 seconds you can just see that all of this UV that they were looking at, it's just got rid of all of it, so that's why we're doing it. Okay. So the important thing to then say is once we've done our 15 seconds, we've we've like sort of completely covered that bung, you then need to wait fully 30 seconds to make sure that it's completely dry, because it's the drying of the alcohol that's the most important bit to kill any pathogens. And on our unit, as everyone knows, we've got our nice red timers, so it's just important to see if anybody's doing their scrub the hub or anything involving using the alcohol swab, that just to remind them to use that 30-second timer.
Yeah, I think 30 seconds is a lot longer than you think. So when you're standing there and waiting, even when you're waiting for the timer or you're watching the clock, you realise like how long it actually is. So even sometimes when you think you've been waiting 30 seconds, you probably haven't.
Yeah. Okay, so that's really just to sort of show. So this was pathogens which were taken from a connector which hadn't been cleaned properly, and these are the sort of things that are growing and we don't want to be inside our babies. Okay, so that's that one. So then if we just move on to the next one, which I'll hand over to you.
Okay, so we're going to talk about taking a blood culture. So as Amy sort of touched on already, I know that this isn't practice that all of us will participate in, but most of us will have seen people taking a culture even if we haven't done it ourselves. So it is about challenging practice if we see people doing the wrong thing. So we're going to talk about the do's and don'ts. It's pretty simple really, but the do's for taking a blood culture: make sure you prepare the blood culture bottle first. So remember that those bottles sit in cupboards or on the sides in the nurseries or in trolleys for, sometimes weeks on end. So the cap needs to be removed, and we need to clean the top, the bung at the top where the needle's going to go through, with a green Clinell swab. And just like when we're scrubbing the hub, we should be cleaning for 15 seconds to make sure we're removing any bugs from the surface, and again allowing it to dry for 30 seconds. So use the sand timer, get other people to help turn that, or use the clock, but make sure you are waiting those 30 seconds. You need to wash your hands, and you need to put on sterile gloves. So we use the sterile dressing packs when we're taking blood cultures, and the gloves are in there. And then we need to use aseptic non-touch technique. So taking a blood culture can't be an entirely sterile procedure because of the way we do it, but it does need to be as clean as possible. So that means that when we've cleaned the skin using our ChloraPrep SEP, again cleaning for 15 seconds and allowing to dry for 30 seconds, that we're not then retouching the surface. So that skin needs to be prepared. We need to make the skin surface sterile before we insert our needle to take the culture, or our cannula, depending on what we're using. So ideally we should collect 0.5 mils of blood. Sometimes it's not possible to get quite that much, but ideally that is what we should be aiming for. And as it says, it's critical for detecting bloodstream infection, so it gives us the best chance of picking anything up. And then we need to be following unit guidelines. So we've got the blood culture policy guideline, we've got the ANTT guideline, which is a trust-wide one, and then we've got the skin prep guideline as well for neonates. And lastly, don't palpate the skin after cleaning, and don't touch non-sterile equipment. And I think maybe sometimes this is where people are falling down. You find your vein, you've sort of palpated it, then you clean the skin, and then you can't quite see where it is, and the temptation, I guess, is to touch again. So if you see people doing that, just remind them that they need to re-clean the skin surface for 15 seconds and then wait for another 30 seconds for it to dry before they put their cannula or needle in to take the culture.
Cool, okay, so that's pretty much all we wanted to say about that. So hopefully, most of this is going to be a revision anyway, but it's just really just to make sure that all of us are sort of aware of what should be happening on the unit, so that we can just challenge anything that might be happening that's like sort of different to these guidelines. So I hope that was useful, and as always, any questions, let us know, drop us an email, and if you've got any ideas for future sessions you'd like, just let us know.
Thanks for watching.
All right, bye.